Welcome back. Intermountain Healthcare is taking steps to support people experiencing homelessness during the COVID-19 crisis. Nisha DeGaring shares the approach Intermountain is taking.
Intermountain Healthcare is reaching out to one of the state's most vulnerable populations during the COVID-19 coronavirus pandemic, those experiencing homelessness. Mikkel Moore with Intermountain Healthcare is joining us now via Zoom. Hi, Mikkel.
Hi, Nisha. How are you today?
Good, thank you. Tell us what Intermountain is doing.
Well, we're doing this in collaboration, actually, with a lot of other people. Both the State Health Department, the University of Utah, and local health departments are working together with Intermountain Healthcare to think about how we respond to needs of some of the most vulnerable populations in our state. And one of those certainly are people who are experiencing homelessness. People facing homelessness deal with all kinds of hardships on a daily basis, and even more so during COVID-19. Living in a shelter, it's nearly impossible to maintain a 6-foot distance between your fellow residents. And so we've been wanting to ensure that those communities get access to testing without needing to leave the homeless resource centers and go to one of our community testing facilities. So we've taken a mobile approach to testing, taking the testing to them.
I know you're also coordinating with multiple county health departments.
We are. It's really important that each of the local county health departments manage support to homeless resource centers, including providing testing capability, but also helping them have access to personal protective equipment and other things. And so we've tried to just be very supportive of those local health departments and their efforts, and thinking about where our resources, additional nursing staff, additional testing capacity, and maybe as time plays on, even having some additional personal protective equipment that we might share with local health departments to be used in settings like homeless resource centers or treatment facilities and other places where people are in close proximity to one another.
Mikkel, what about medications if they do need those?
So one of the things that we encountered early on in this pandemic was as homeless people came to the hospital for care and then were encouraged to isolate or quarantine while they awaited either test results or lived with COVID-19 in a way that they didn't want to put others at risk. We really worried about them being able to have access to medications. Oftentimes people came into the hospital at night or on the weekends, and with restricted pharmacy hours, it was really difficult to get them their medications. Now, there's not really a medication for treating COVID, as you know, but most people have a need for medications for some other chronic condition like diabetes or hypertension or other diseases. And so we've been able to kind of go around the normal processes and have our hospitals discharge anyone who's homeless with a 14-day supply of their medications so that they have no barrier really to going with the homeless resource coordinator worker who helps them get isolated and quarantined for a 14-day stint.
We should let you know that all of these services, everybody, provided without cost as part of Intermountain's community stewardship. If you would like to know more, go to our website and we will link you to Intermountain Healthcare's information. That's abc4.com. Mikkel, thank you so much for joining us.
Thank you.